Okay, let's talk about ankles because a lot of our patients come in because they've had either chronic or acute ankle conditions. And one of the first things you want to do when you're examining it is just like you would with the knee, look for the passive movements, ask the patient to move it themselves, and then passively you move it with them, having no restriction or force against you. And then check their dorsiflexion, plantar flexion, their inversion, their eversion, just see how their overall range of motion is, and then listen to that joint. Is there crepitus? Is there clicking? What's their history? Because ankles, for some reason, we get phenomenal results when we inject into the ankles. And typically, an ankle joint, it's a smaller joint. You can get away with doing either a half to a full unit. And sometimes with a full unit, you can do both the lateral aspect of the ankle and the medial. Um, but most of our patients, when there's chronic ankle conditions, the ankle will start to fuse. And so one of the things you want to do is find the areas that are the most tender. So you're going to be palpating around the medial malleolus or the lateral malleolus, and you're going to be finding little spaces within that joint. And then what you're going to do is you're going to be injecting about a half of a unit, a half of an ml into that particular joint space. And what you'll see is the cartilage will start to regrow, the patient's swelling will go down. You'll also see that they won't need to get their ankle fused. And so with ankles, you may also want to look right on the dorsum of the foot if there's any metatarsal issues. You can inject into the metatarsals. You just want to find out where you feel the most locking in the joint itself. If they're having crepitus, if that joint's not very mobile, then you want to isolate exactly which articulation is affected. And then if you're using ultrasound, you can use an ultrasound machine to guide the needle. But in most cases, the stem cells, you can just kind of fan them throughout the entire area where the patient has pain. But at least 90% of the ankles that come in, it's the lateral malleolus or medial malleolus, and even probably 70% of the time it's lateral. And so what we'll do is we'll find 2 or 3 really sensitive spots and inject around those sensitive spots. We just had a patient of ours. She's 85 or 86. I can't remember exactly, but she just called yesterday and just wanted to thank us. Her ankle is doing so incredibly well. We injected 2 spots on her lateral malleolus. It was from an automobile accident that she was in 20 years ago. And her ankle swelling went down. She's able to walk again. We had one of our patients, as you can see here, is a 70-year-old man with complete ankle cartilage degradation. I mean, there's nothing left. His ligaments were elastic. He was facing an ankle fusion. 30 days following the stem cell injections and acupuncture, because you're doing acupuncture weekly following the injections, he had a 75% improvement in dorsi and plantar flexion restoratives. Incredible. He wanted to prove it to me, and if you look on our website, you'll see this funny guy with kind of lots of full, thick head of gray hair, but he wanted to do a testimonial, and he was just really enthusiastic about that. His wife actually made him do the procedure. He's like, I can live with it. It's no big deal. And his wife said, no, you can't. You need to do this. And he's like, come on, I'll be fine. And we just did a half a unit in him. He said he was skeptical. He didn't think. He's like, it's not going to work. I've had this injury for 50 years. Got it when he's 20. And so anyway, it was interesting to see his response. We had another patient. She had a 6-month acute non-healing ankle sprain. This happened at a casino, and it was so swollen. She came in, and it's still the coolest story I've seen with stem cells. The coolest, like fastest recovery. I've seen other stories that are more incredible than this one, but she came in and we looked at her. Her ankle was swollen. She's in a boot. Been going that way 6 months. You'd look at it and you'd think it happened like a couple days ago. That was her ankle was so hot and swollen, and so we did the injections. And she came the next day. We did an injection. Actually, hers was on the metatarsals. So she had some. We did half a unit in her lateral malleolus, just underneath the malleolus. And then we did some right in the dorsum of her foot. And she came in the next day and was just shocked. She woke up that next morning, no ankle pain. She stepped down from her bed and no shooting pains up into her leg. no swelling, nothing. She came in without her boot on, and her ankle has been perfect. So that was the fastest turnaround we've ever seen. But ankles, you're going to get great results with them. You don't want to overcomplicate it. You're going to want to look for a space where you can actually get the needle into it. I know with the metatarsals, sometimes it's difficult to find a little space where you can actually get the needle in. So you can use dry run, use some preservative-free lidocaine, or use an acupuncture needle to guide yourself before you actually do the injection if you're not confident in where you're going. And then just fan it over multiple tissue structures because once again the stem cells will be able to home in on areas that are damaged. We had one of our staff member here at East West, she actually got her knees injected, and the day before she got her knee injected, she had a very massive ankle sprain, and from getting her knees injected, the next day her ankle sprain was gone. She had no pain. And I thought it was pretty impressive. The stem cells, they do tend, I wonder if it's because of the gravitational forces, but you're going to get awesome results with ankles. So when you see a patient with ankles, once again, let them know, yeah, there's a great chance you can help them. Make sure you're doing the baseline read, how much strength they have. Can they go on the tippy toes? Can they not? Can they lift it? Can they dorsiflex with 10 pounds of pressure? Document all those things so you can really test the outcomes. But I think you'll find that ankles are one of the most simple joints to inject.